to NMP Talk Show, where we delve into the depths of mental health wellness with compassion, understanding, and expertise. Our goal is to provide a safe space for open conversations about mental health, destigmatize the issues surrounding it, and offer insights and resources to support your journey towards a healthier mind and soul.
Ladies and gentlemen, welcome to another enlightening episode of NMP Talk Show. We have a very special guest who will be shedding some light on a topic that is incredibly important yet often misunderstood: mental health therapy. Joining us is Lyr Weltsman, a distinguished therapist with extensive experience in helping children, teenagers, and adults navigate the complexities of mental health. Leah's compassionate approach and profound insight have made a significant impact on countless lives. And today, she's here to share her expertise with us. We will delve into the unique challenges faced by different age groups, explore effective therapeutic techniques, and discuss how we can all contribute to a more supportive and understanding environment for those struggling with mental health issues. So, whether you're a parent seeking guidance, a teenager looking for support, or an adult wanting to better understand your mental health journey, this episode promises to be both informative and inspiring. We're also looking forward to you connected on Telegram and Riverside for your questions and comments during the show. Without further ado, please join me in welcoming Lyr Weltsman.
Thank you so much. Thank you for having me. I'm really excited.
Awesome. Thank you for honoring this invite.
Yeah.
We're looking forward to it. So, Leah, in my introduction, short introduction about yourself, I already spoke that what you're doing, but I'd like you to introduce yourself. Tell us who you are, and especially the organization that you're running, so that we can have our audience, in the same page before we delve into the topic.
Yeah. So I'm Leah, as you said, and I'm a child, teen, and family psychologist. So providing therapy specifically for children, teenagers, and parents and families. And the organization or company that I founded is Breaking the Chalk, which is an online therapy practice. So providing therapy and mental health support virtually. So for clients really anywhere in the world and at the comfort of your own home, you get mental health care. And it's really from, when I started in the world of mental health and working specifically with children and studying about them, that really is what inspired Breaking the Chalk and really breaking the way we provide mental health care.
All right. So you're saying you can connect with anyone around the world. So in the comfort of their homes, you are able to give that support.
Mm-hmm. That therapy. Yeah. So it's really just online, virtually, through a video platform, and you gain therapy for your child, for your teenager, for yourself, as a parent, as a family member.
Yeah. I like how you embrace technology because, some of us, when you talk about therapy, you're afraid to go out there and look for a therapist because, the misconceptions that's there already. If you go to a therapist, we all think, or we might think that you're cuckoo there,
Of course.
and which is not the case. And hopefully our discussion today will dispel all those, that people are thinking, if you're looking for therapy, then there's something wrong with your IQ or whatever they want to refer it to.
And it's so misunderstood because I always compare it to like our physical health, right? So like if you have I don't know, some physical illness, you won't be shy to go to the doctor or
No.
embarrassed to mention it.
Yeah.
But if
Yeah.
it's something to do with your brain, which is a part of your body, anyways,
Mm.
then there's
Mm.
so many, myths and stereotypes and stigma that's attached, when really with everyone has mental health. You, me, the listeners, whoever, everyone has mental health. Some of us just struggle with it, just like that physical health,
Sure.
and some of us just struggle with it. So,
And you're right. I was reading some articles, and they also said that everyone, we all have mental crisis, mental issues. It's how we deal with it, and some are okay. They're able to deal with it, fairly, but some of us may need to have somebody intervene, help us, support us,
absolutely.
hold our hand, so that we can navigate the streets of mental wellness. So let's jump into the meat of all things, right?
Yes.
What is your experience and background in working with children, teens, and adults dealing with anxiety and depression?
So I've been in the mental health field for over 8 years. And first started off just really by, advocating. So doing a lot of speeches and talking to the government, really trying to advocate for the youth's mental health, for better care. And I started studying it, and psychology and art therapy and play therapy and child psychology and psychotherapy, like all the different therapies and psychologies. And then it's been over 8 years where, specifically with anxiety and depression, where anxiety is the most prominent, really. It's, I provide therapy for it. And really something that I think is really important with anxiety and depression, specifically for patients, is understanding it. So, really learning about it. What does it mean? Where does it come from? What are my triggers? And then to get the tools on how to help, how do I help myself after my session with you? What do I do about my depression? So my experience with it is working specifically with children and teenagers for 8 years, with different ages, really from, my youngest is 5 years old. My oldest is 22. So really a broad spectrum of ages. But that's really the beauty of it. But my studies are specifically around youth mental health. So that's really the specialty. Yeah.
I guess for you could also be a challenge to walk into your office or connecting online with somebody, a family there that are needing your services, and it's a 5-year-old.
Yeah.
How do you handle that? We always talk about the other side of the story, us looking for assistance from you, but we never talk about you who are offering that service, assistance, that you have to listen to. I don't know how many families or how many people that are coming crying to you, needing help.
Yeah.
Where do you find help yourself? How do you deal with it, though?
So,
like from your personal experience, yeah.
There's a lot. I mean, there's a lot of different. Working with a teenager, with an 18-year-old versus a 5-year-old, is very different. A 5-year-old isn't going to sit with you and be like, today this is what happened. Not going to do that. So it has to be very interactive. So like games and drawing and listening to the 3,000 stories that happened at play school, and being really interested, and it takes a lot of energy. So it's hours of really like sitting and listening, and every single patient is so different, with different challenges, different ages. So one can be just sobbing for an hour, and the other can be 45 minutes of playing and talking about feelings, you know? So it's very different. And at the end of the day, sometimes I like leave the space and I'm like, don't talk to me. I cannot hear anyone because you really
can't
give
deal.
it your all for hours on hours and hours.
Yeah.
And for me, especially, I don't only work with the client for that hour. I'm always on the phone with the parents afterwards, and then it's feedbacks, and then it's she's not going to school, what do I do? And then it's working, you know, as soon as you wake up it's talking. And so it's a lot of patience and compassion, but if it's something that I really love doing, so it fulfills me just as much. But it's definitely intense. It's definitely intense.
I guess that's the key there.
Yeah.
I guess that's the key, having passion for that. Because otherwise you won't survive.
No,
you have to.
No. Yeah, but it comes from a personal space as well. So I think that's why there's also a lot of passion behind it.
Okay. So I guess this opens up another question that I can ask. The therapeutic approaches you have or you commonly use when you treat anxiety and depression, because we touched on the difference when you're dealing with a 5-year-old, a teenager, and you also have an adult as well, you know, that you're dealing with, and then reports thereafter. But what therapeutic approaches do you commonly use when you're treating these two aspects, anxiety and depression?
So there's mainly 3 that I use, which is, so I specialize in cognitive behavioral therapy, and that is specifically really good for anxiety and depression, but also anxiety, is changing how we think, basically. So we can think in a very negative way or in a very unhelpful way, and that affects how we feel, which affects how we behave. And so we go right to the start and we talk about, okay, well, how can we think differently, or how can we change how we're thinking? Really kind of taking control of our thoughts. So cognitive behavioral therapy is one main approach that I use. And then the others are play and art. And this is specifically with the little ones, but also with adults who experience trauma. So art and play therapy is just a different way to express yourself, basically. And when we don't have words for what we're feeling or what we went through, then we draw it and process it in that way. So specifically, you know, in the world of trauma, in the world of depression, we use art and play. And then cognitive behavioral therapy is one of a specialty approach that I use. Nice.
That must have put a lot of thought into designing that work frame. It does, eh? And your tailor, how do you tailor your therapy approach when you're working with children versus teens and adults? And I know you touched on that in that you're using drawings and speaking and all of that, but can you expand a little more on that?
So with children, right, with kids, it has to be very interactive in order for them to really team with you to talk about things. So with children, it's very play-based and art-based. So a lot of games, a lot of stories, a lot of acting out. That's one approach with children. And then with teenagers, it's a lot of relating to them. So knowing all the lingo and doing a lot of practical work. So getting them, you know, when you're in this situation, this is what you're needing to do. And really just giving them, specifically with teenagers who are really misunderstood, is to really give them that space to just talk about anything and about everything in that safe space. And with adults, it's very informative and practical. So getting them to understand what's going on with whatever it is that they're struggling with or whatever their child is struggling with, and then being practical about it. So again, same as the teenager, what can I do? How can I help myself? And giving them the tools, and then they are empowered. And above that, there's the tailoring of every patient is different. So what I do with patient A is going to be completely different to, even if patient B has the same anxiety as patient A is a completely different person to patient B. So my approach is going to be different as well. So it's not only tailored to the age, but also to the patient. If that makes sense.
Yeah, because it does make sense, because I think you can be caught in a standard to say, okay, if you come with this certain mental health issue, this is what you do. No thought goes into it for a particular person, because I would understand that there will be extenuating circumstances that are pushing the person to be on that level.
Yeah.
Right?
Absolutely.
And those circumstances are different to the other person.
Yeah.
So if you follow standard, it can be a misdiagnosis, eh?
Of course. Yeah. And also,
Yeah.
it's so not black and white. There's no box to it. And that's what's also really hard with children and teenagers is, a parent will be like, well, it's not working, or this isn't working. And I'm like, well, we can try. Patient A, it works great with patient A that has the same symptoms, but now we need to adjust it. Because everyone responds differently to the treatment, and everyone takes a different time to it. Right? So someone can be really good within 3 months, some 2 years. It's different for everyone. We all have a different psyche. We all have different, as you said, circumstances and contexts. And we have to take all this into account in therapy and in their approach. So it's definitely complex. And it's not straightforward at all.
So. I can imagine.
Yeah.
I can imagine. So, my word.
Lyr.
I've got Lyr. Yeah. That's a tongue twister for me. Lyr.
Lyry is easier. Lyry is easier.
Lyry.
Yes. There we go.
Okay. All right. Okay. Or should I say Miss L?
Miss L, yeah, there we go. Well.
All right. Yeah. So when you're working with especially anxiety and depression, right?
Yeah.
Do you find that there are similar triggers between the three groups, like the children, the teens, and the adults?
Yes, very similar. So most of it is most of it is because of things that are really that the feeling of being out of control. So maybe something's changing in the family, maybe there's that confidence, maybe there was trauma that happened, so like a divorce or some change of school, something like that. Parents, big trigger. And all of it, all that out of control feeling that comes from a change in school, a change in environment, a trauma, parents, same concepts, come out as anxiety, or come out as not being able to regulate yourself, or comes out as low moods. And it's presented slightly different in each age group, but it's the same patterns, basically, of that out of control feelings that really makes someone freak out, basically. As soon as something doesn't go to plan or something changed in environments, our inherent systems just kind of get blocked, and we're like, and we freak out, and we don't know what to do, and it raises that anxiety or drops that mood really low. Presents differently in different age groups, but a lot of it has to do with that feeling of being out of control and that change that happens in our environment.
Yeah.
Yeah.
We all going through a lot, eh?
A lot. So much. So much.
Yeah.
But very
You
similar.
can't even describe it.
Very
similar. Yeah.
Yeah.
And like you said, some of the things are out of your control. So we can't really say, no, man, come on, snap out of it. You know?
Literally, it's like, oh, no, my parents must just get back together. Sorry,
Yeah.
it's not going to work, you know?
It can happen.
And that's... And one of the things with therapy is we want to show the patient that how they respond to the trigger is where their power is.
Oh.
And that's really where the tools come in. Is there's going to be a change, and that's out of your control, but how you're going to respond to it is, and that's your power. So... Yeah.
So you really need to know yourself.
Sorry?
So you really need to know yourself, because
exactly.
How do you determine how you react to the trigger?
Yeah. And that's part of that awareness, right? Like that cognitive behavioral therapy, that awareness of being like, oh, this is triggering me. Okay, I need to put something here to help myself. Or this is out of my control. Okay, I know this is my pattern, so this is what I need to do. And that's why we aim to make it quite practical, so that they know how to respond to it. Learning a lot about yourself.
No, it does make sense.
Yeah.
Now, when you're working with children and teenagers, do they need to have a guardian present, or the parent present when you're doing the consultation? Or it can just be them? Okay.
Yeah, preferably not. Sometimes for the younger ones, they want their parent to be there for the first session, because they're like, who's this random lady that I'm going to now speak to?
Yeah.
So first time, it's like, that's fine. But afterwards, it's preferred not to, because this is a space where the child can say anything, even about the parent.
Open up.
So if the parent's going to be sitting there, it's like, oh, it's going to be a bit weird for them. So, for therapy, a big thing is confidentiality. So the parent, we don't really want the parent to be there. So it's important for the door to be closed and for them to have their own space. So I always recommend to do it in their rooms, where it's private, it's quiet, it's their own safe space. Parents are involved in the process, but they are not involved in the session itself.
Okay. That was my next question.
Yeah.
Because if you were to deal with my child, let's say I had a child, and they're opening up to you that way, you're somebody online out there, and they're opening up to you. I'm staying with my child in the house, and you find out that there are things that needs parents' attention. And you spoke about confidentiality there, but if parents need to know what is happening to a child, so that they can adjust the environment for the child, they would need to know the details.
Absolutely.
So where do you draw the line between confidentiality between the child and the parents?
So confidentiality is broken only when there's like a threat. So if the child or the
Okay.
teenager is like suicidal, or there's abuse going on,
Suicidal.
anything like that, like there is no confidentiality. It's broken. But the things that are feedbacked, if that's a word, feedback back to the parents is what
Yeah.
they need to do to help the kid. So
Okay.
this is the breathing technique. This was discussed. Can you expand? Please remind them to do XYZ when they are feeling angry. Whatever,
Okay.
right? I really recommend you to not shout at them when they're crying, right? So it's like a bit of guidance for the parents more than anything, which is really appreciated. And if there is a parent meeting or something that I really think should be brought up, it is always discussed with the child first or with the teenager first. So is it okay if I tell mom or dad? Is it, is there anything you do not want me to say in this meeting? I will not say it. So very much everyone is in the loop of what's happening.
Okay.
So there's no, someone feels betrayed or in the dark or anything like that. Parents very much respect that confidentiality. And it's most effective when the parents take on the feedback that they're given and really action it out. That's when we really see progress. When the parents don't do what's being in the feedback, progress is a bit slow. Because it's a kid at the end of the day.
That's true. That's so true. So I want to welcome those that are connected on Telegram. Welcome to the show. If you do have a question or comment, please raise your hand and we'll give you an opportunity to speak to our guest. And those that are also connected on Riverside, you can do the same by typing your question or your comment on the chat section there, and then we'll read it out. We also have those that are connected on YouTube live now. You also would be able to type your question there, and then we can read it out to our special guest. Now, as we propel along, right, we've seen how confidentiality is very important and how which circumstances that is broken, and the different types of therapy that you give to the different groups, which is a child, a teenager, and an adult. So how do you measure progress in therapy, and how often is progress reviewed?
So how do we measure progress is different for each patient, obviously.
Yeah.
We look at initial challenges, so why the patient was brought into therapy in the first place. And as we are dealing with a specific issue, we are basically tracking. I'm tracking with my notes. Parents are tracking with the child's behavior. We are tracking with parent meetings or with adult meetings, whatever. So let's just say a patient's struggling with, getting up in the morning, right? It's depression, getting up in the morning. Not getting up, they're not getting up, and then a month later, they start to get up. So that's, according to what the challenge is that we're dealing with, we track it as we go along, really.
Okay.
And we review as we go. So we review, we adjust, we discuss it. I do check-ins a lot of the time. And then we have, if it's with children and teenagers, with parents, we do like a parent check-in. So almost like a progress review every second month, perhaps, every 3 weeks. It really depends on the patient. And we discuss what's been improved, what's not been improved. Also with teachers and with psychiatrists. So there's an appointment coming up with the psychiatrist. This is what's happening. So that's how we really keep in the loop. And that's how we track
That's
it.
good.
And
That's
according
good.
to feedback as well.
Awesome. We do have a comment on YouTube. I think it's a question from Bafana. He says, thank you, Leah. What would be your advice for someone who struggles with ongoing negative thoughts related to what one is going through when some techniques such as what is that? Diaphragmatic breathing exercises or the 5-4-3-2-1 method
Yes.
isn't working? Could you perhaps also suggest an advanced level of anxiety on that individual?
Mm-hmm. Okay. Yeah. Can I respond?
Yes, please.
So the 5-4-3-2-1 or the heavy breathing is more for calming down than with negative thoughts. So it's more like if you really panicked or you're super anxious and you can't breathe or you're feeling really overwhelmed, then those two techniques would help you because you're basically calming down your nervous system. But with negative thoughts, that's different. So you first need to calm down before you do these techniques. So you can use the 5-4-3-2-1. But with the negative thoughts, you want to basically do two things. So first is to challenge them. So if your negative thought is saying everyone hates me at work, let's just say, then it's like, okay, well, who is everyone? Right? Who is it? Name it. If you can't name it, then it's not really everyone, is it? So you're basically wanting to see, is my thought a fact or is it just an assumption because I'm anxious or because I'm insecure about something? If it's an assumption, you know not to believe it, and so you can change it. Most of the time it is an assumption because it's a negative thought. So challenging the thought that comes up. Is it a fact or is it an assumption? What evidence do you have to back it up, really? And the second one is to change it from an unhelpful thought to a helpful thought. So that, which is the negative thought. So if it's everyone hates me at work, then you're basically saying, I know you may be not feeling so confident at the moment. This is really how you need to talk to yourself. I know you're not feeling so confident at the moment, but you have this colleague that really likes you. You sit with this person at lunch, right? And kind of giving yourself good affirmation. So you basically want to like switch the thought. But in order to do that, you really need to notice them. So as soon as you notice the thought, swap it. But it takes practice because you need to basically like rewire the brain. So every time this person has a negative thought, they have to swap it to a helpful one. Or they have to challenge it, which is hard. But
and I guess also, well, I'm not a professional at this, but I'm assuming correct me if I'm wrong, you're the professional here. But I'm assuming once you start those thoughts, you don't wanna dwell on them for a long period of time. Exactly. So the moment you get that trigger, already you've told yourself that the moment I do this, I start thinking negatively, let me rush and point out the positives. Because if you dwell on the negative thought, it's like a quagmire. The more you wiggle, the deeper you sink.
100%. 100%, exactly. Because then I say to myself, there we go, professional. So you're basically saying to yourself, everyone hates me. Yeah, everyone really does hate me. Did you see how yesterday? Oh, and look at the spiral that I'm going into.
Yeah, spiraling down.
No. As soon as you catch yourself with a negative thought, you're saying, stop, hold on, let's change it. Let's challenge it. Let's change it. How is this thought going to become helpful for me? Because the negative thought is unhelpful.
Yeah.
So,
thank you for that, Bafana. I hope your question has been answered. If it has, please post a thumbs up or something there. And Tabang also has a follow-up question. What's the best way of getting someone to go for therapy?
Tough one.
Tough one.
Tough one. So, firstly, the person who you want to go to therapy needs to be open to therapy. If someone isn't open to therapy, it's not useful. So first approach the person with, would you be open to it? Or maybe we can look together. Is this something you would want to do? Because I can refer someone to it, but the person needs to be open to actually going, right? So asking, figuring it out. And then if someone wants to, refer, look for someone that the person would suit according to what what they're struggling with, according to if they want a man or a woman, if they want online or offline, whatever it is. And then you can kind of connect the two. But just know that whoever you're referring to, you are now out the picture once you've referred. No one can get you involved, if that makes sense.
Okay. Yeah, but like you said, it's a difficult one, because if you say to someone that I think we should go look for therapy, they might turn around and say, "Do you think I'm crazy? So am I the problem?" And then now, where do you run to now? You've opened a can of worm, and you've actually taken that person 10 steps behind, because now they start judging themselves as inadequate. That's a tricky one there.
It's a tricky one. So it has to be very, very slow, and it's just kind of like putting it. So not being like, I think you should go to therapy. Someone would be like, excuse me, right? Just be like, I saw this person and he's so interesting. Like, I would love to go to this person, right? Like, very open-ended, doesn't have to be exact. And just talk like, what do you think about therapy? Almost bring it forward with like interest, intrigue, and not very specific. Depends who you're talking to. Everyone's different.
Need tact.
So just with a little bit of like empathy and compassion, and very open.
All right. Tabang, I hope your question has been answered there. You can also do a thumbs up or just type if you're okay with it. Bafana said you've answered the question very well.
What's that?
Thanks for
Good
that.
luck.
Yes, yeah. All right. So I haven't heard you speaking about medication. Do you prescribe medication? What are your thoughts on it? Okay.
So I don't prescribe medication. I'm not a psychiatrist, so I can't.
Oh, okay.
I can recommend it as something to look into for a patient. I am always in contact with psychiatrists of patients of mine, but I don't prescribe medication. I'm in the team of it, but I'm not one to prescribe. Medication is good when it's needed, and medication is helpful when it's prescribed properly and well. Where a lot of the time it's so over medicated, and so I'm when a patient takes medication, I'm very on it, right? So I'm like, when did you start? How are you feeling? What symptoms are you having? Not symptoms, side effects. What side effects are you having? I think we need to review it. Then I update the psychiatrist. So I'm very much in the loop, because medication is intense. Like, there's a lot to it, and there's lots of side effects, and everyone responds to medication differently. So it is good when it is necessary, and when it is not necessary, it does more damage than anything. So very much depends.
There is a balance there, right?
For sure. And also, a lot of the time, people just think, oh, I'm just going to take some meds and my problems are fixed. And it doesn't work like that. There has to be a mix of everything together. But medication is a plaster, but it doesn't actually heal the wound. right? It's
The
like, oh,
wound.
it's nice, it stops a bit of the bleeding, but it
Mm.
doesn't heal it. So
I, I think the environment also plays a very important role.
of course, huge role.
Because if the environment is not good, it doesn't help taking medication where when it wears off, you're in the same environment that triggers.
Absolutely.
So fixing the environment and getting the support from the family, friends, everyone that's around you would really go a long way.
Yeah,
That's what I think. That's what
100%.
yeah.
The environment is a
Yeah.
huge part in all of this. Specific, you know, when someone's struggling with severe mental health disorder or challenges, the environment can really trigger. And if they have support from their environment, it is very, very beneficial for their process. And unfortunately, sometimes they don't have that. So it's, you know, looking at your triggers in your environment, the people in your environment. And for a child or for a teenager, that's why parents are so involved, because they are the environment.
Yeah.
So yeah, I agree.
Makes sense. Yeah.
Yes.
So there's a crisis now. How do you handle crisis or emergency situations, particularly with children and teens?
Okay. So obviously depends on the emergency or crisis,
Yeah.
but I'm always available. So when there is an emergency or crisis, I usually get a message from a parent or from the teenager or child themselves, and I am on the phone. I immediately get into contact with someone that's, you know, there, and I'm on the phone, and we basically see, okay, let's just say the crisis is I'm having a panic attack. I can't breathe. I don't know what to do. I'm out with friends. So it's okay. I'm now basically guide through the crisis or the emergency, whatever it is, right? So it's literally guiding them through it, or it's giving parents guidance through it. So it's like literally typing out throughout. And so, you know, it needs full attention because it is a crisis. So it definitely needs that, but it's literally guiding, breaking it down, because when a patient or a parent is in crisis, they can't think straight, right?
They can't think.
They're
Yeah.
irrational.
Yeah.
They freak out.
Yeah.
So I need to be the calm one. I need to be the mediator to calm down the situation. But there's lots of them. But
we're very thankful to have. We're very thankful to have people like you. Eh? We need you.
It's intense, yeah. We all need sometimes that, you know, that helping hand.
Yeah,
for sure.
sure. Yeah. So what strategies do you use to help clients to build coping skills outside the therapy sessions?
So for each thing, there are different strategies, right? So for example, the guy that wrote on YouTube, the comment. So that is a strategy, for example, that's a coping skill that's been given. So when he or she, I don't know who it was, or they are outside of session time, when they're actually in those moments of having those negative thoughts, they now know what to do. So, for example, it can be how to calm yourself down. It can be how to change your thoughts. It can be how to manage when you're feeling really low or really overwhelmed. It can be a coping skill, can be how to calm yourself down when you're really angry, or how to communicate with your parents. Depends on what the patient's there for, right? But it's very technique based, because it's nice to talk to me for an hour, and then what happens? I don't know what to do in that situation.
Yeah.
My therapist isn't there. So it's really important to, you know, give those strategies, whatever they may be, outside and adjust it. Some things will work, some things won't. But what I can say is that with coping skills, with these techniques, essentially, is consistency is key with them. So in order to see a positive effect, we need consistency.
Wow.
I went on a rant, but
Yeah,
yes.
I couldn't have said it better.
Yeah.
So yeah, we're almost there with our show, and we spoke about techniques. We spoke about confidentiality, approach to medication, and handling crisis. Right?
Mm-hmm.
Do you have any success stories you would love to share with us?
Oh, of course. Let me choose. Today, I'll give you an example
Okay.
of a success story today from a session
Fresh
that I
from
had
the
early
oven.
on.
Yeah.
So I've been working with a teenage boy from England with severe anxiety, different anxiety struggles, but basically doesn't leave the home anxiety. And worked super hard and really like twice a week sessions and everything. And this process usually takes a few years, right? And it's now a year. So I know it sounds long. But it's not for the condition that he is in.
Yeah.
And he was like, Lear, on the weekend I went out.
Oh,
And I
nice.
went for a drive and I went to a restaurant. And this patient doesn't leave his house. Right?
Wow.
Didn't go to school. And I was like, what? It's like, oh my God, that's amazing. You don't want to like overplay it because then it's stressful.
Yeah.
But inside, you are like explosion. So that's one from today, which is really, really big. Like really big. I know it sounds small, but it's big for the condition that he's in. And like a lot of the times, for kids that struggle with anxiety, for example, I had a teacher call me and she was like, I don't know what you did to this kid, but she's talking and she doesn't cry anymore at school. And she's, super talkative and has friends now and, completely different child. So there's lots of different ones in different ways. But it's always really rewarding to see,
That is so good to hear.
Yeah, it's really cool.
Wow.
It's really cool.
It is very encouraging as well.
Totally.
And especially when you sitting from my side, being a listener, there are successful stories out there.
Absolutely.
And you're not alone out there. There are people that are struggling like you're struggling, and they've taken a step forward and looked for help.
Mm-hmm.
And there you are, hearing the success story. So basically what I'm saying is, if you are going through a mental breakdown, we need to seek help.
Of course.
We need to speak to somebody.
Mm-hmm.
Now, you are a therapist, right?
Yes.
So we have therapists, we have psychologists, and we have
lots.
We have lots of them. Yeah?
We have counselors. We have social
counselors.
workers.
Exactly.
We have psychiatrists. We have psychotherapists. We have lots.
So, what fist do you go for when you have a mental breakdown?
So two. Depends what it is.
Yeah.
So if you want to get a diagnosis, for example, like a formal one with medication, then you need to go to a psychiatrist.
Mhm.
If you want someone to talk to and debrief with and gain skills and have like this space to really talk through your struggles, we basically all do the same thing. It's just different titles, I guess. So like a psychotherapist would be really good for trauma, as an example.
Okay.
A cognitive behavioral therapist will be really good for anxiety or OCD. A counselor will be really good for everyday mental health struggles, or just challenges, really, someone to talk to. A clinical psychologist, so a psychologist will be really good for mental health disorders. And a social worker is almost like, not almost like, but one of the therapists. But really,
Okay.
honestly, one of the most important things is that you click with the person that you're going to. You feel safe, you feel comfortable, you feel open, right? That click is really important, because otherwise it really does damage more than anything. And that you can actually see an improvement in your feelings and in how you're managing. More important than the title. So,
Click.
that's really important. That click.
Yeah. All right.
Yes, absolutely.
Yo, Leah, thank you so much, man.
Thank you.
This was very insightful, and I know my audience have benefited from this, and we're going to post this show on different platforms, and whoever will be listening, I know that they will benefit from it. We do have a comment or question on Telegram. Let me add. Hilda, welcome to the show. You can unmute yourself there.
Thank you so much for the time, Leo.
Pleasure.
One question to your guest. Working with mental health issues, assisting people, do you sometimes feel overwhelmed? And if so, do you also go for counseling or not?
Good question.
Yeah, go for it.
Thanks for your question. So a few things here. So the reason why I became a psychologist was because I struggled with my mental health. So I definitely go to a therapist. And of course, you feel overwhelmed, specifically after like a really long day of sessions, or if there was crisis during the day. You get drained. I think what the word is drained. And so because of this, I'm very strict on rest and self-care and me time, because otherwise I can't provide what I need to provide to them if I'm completely like depleted. To answer your question, yes. I do go to my own therapy, and yes to getting overwhelmed. So for sure, of course, you're taking on a lot.
Yeah, that could be a lot. I mean, if one is struggling with their own issues, and then you have to deal with many people's issues, you have to be a super person, superwoman in your case, to handle those. So I'm glad that you also getting support of some nature, so that you can deal with it. Otherwise, we will bury you.
For sure, of course. And also, you have to, once I close the laptop, I'm like, done.
Yeah.
Goodbye.
Yeah.
And you have to be very objective. But in general, we have supervisors as well that kind of guide us with our patients.
Okay. Okay. All right. I've had a rheumatologist joining the show, being a guest on the show, and what she said is she was also struggling from rheumatic disease as well. So does it happen that when you struggle from something and then you get so interested in it, on how to deal with it, that you become not a pro, but you become a best person to help others deal with it?
I think so. I really think so, because you really, it's beyond theory. It's
Yeah.
beyond just learning about it. You've experienced it, and a lot of the time I get clients and they're like, yes, that's exactly what it is. And I'm like, I know, I felt it.
Been there, yeah. Yeah.
Exactly. So it's very much when it comes from a personal space, an experience. I think you extra pro a little bit sometimes, because you really, a parent said to me, the reason why I chose you to be my daughter's therapist was because I saw that you went through it as well. And I was like, oh, she'll get my kid. And I was like, I do get her, Mom. So a lot of the time you feel almost not exactly, of course, but you get it. You get it beyond just the theory of it.
Just the theory. Yeah.
Yeah.
And you know which questions to ask.
Exactly. You you read it more. Yeah, for sure.
Yeah.
Absolutely.
So for the benefit of my audience, you said you international. You consult everywhere.
Yes.
As long as people can connect in the comfort of their homes.
Absolutely.
Do you only do online, or do you also do in person?
Only online.
Only online.
Yes.
Okay. All right. And where you based? Are you overseas, or you in South Africa?
Most of the
You're
time.
in Johannesburg.
Most of the time.
Okay. All right.
Most of the time in Johannesburg.
All right.
Yeah.
Now, I knew that. I just wanted for them to know that I'm speaking to somebody who's local.
I'm
sometimes
all local, born and bred.
Born and bred, yeah. Don't be fooled by the name. She's probably South African.
Yeah.
Right.
Totally.
All right. We've reached the end of our show. Just your closing remarks before we sign out, and to say to the audience there.
If you are struggling with anything mental health wise, know that there's help out there. Know that you can get help and that you should get help. And it's brave to do so, and it's requires a lot of strength and resilience, and you deserve it. So if you need help, get help, and it's out there. It's there for you. So always.
Thank you so much. I always write my closing remarks so that I don't mess it up. And you've mentioned a lot of things that really captured the essence of promoting therapy, and then I really appreciate that. So, ladies and gentlemen, as we come to an end of today's enlightening and heartfelt discussion about mental health therapy, I want to extend my deepest gratitude to our incredible guest therapist for sharing their profound insight, wisdom, and compassion with us. Thank you so much, Leah, for that.
Thank you.
And to everyone tuning in, remember that reaching out for help is a sign of strength, not weakness. Mental health is just as crucial as physical health, and seeking therapy is a powerful step toward healing and growth. If you're struggling, know that you're not alone. There are professionals who care deeply about your well-being, and they are ready to support you through your journey. Each of us has the capacity of resilience and recovery. It might not be an easier path, but with the right support and self-care, it is absolutely possible to navigate through the challenges and emerge stronger and more self-aware. We encourage you to take that brave step forward, whether it's by talking to a therapist, confiding in a trusted friend or family member, or simply acknowledging your own struggles and giving yourself the grace and patience to heal. Thank you for being there with us today. And remember, taking care of your mental health is a continuous journey that deserves your attention and care. Be kind to yourself and reach out if you need help. We believe in you, and we are here to support you every step of the way. Stay strong, stay hopeful, and take good care of yourself. My name is Neo Morapedi, the host of NMP Talk Show, and we're signing out. You need internet and you need pussy.